Hello and welcome to our video on heart health and cholesterol. My name is Barbara Kennedy and I'm the Executive Director of the Cardiac Health Foundation of Canada, and I'm here to moderate a panel with Dr. Peter Lynn and Dr. Shafiq Qaadri. The one thing that I want people to know and remember about their heart health is that it's important to know your cholesterol levels and important to manage them for your cardiovascular health. And you've got to keep your good cholesterol levels high and your bad cholesterol levels low.
Hi, I'm Dr. Peter Lynn, and I'm a family doctor in Toronto, and I'm also one of the directors at the Canadian Heart Research Centre.
My name is Dr. Shafiq Qaadri. I'm a Toronto family physician, and it's a privilege to share some of this information with you today.
You know, a lot of times we talk about heart attacks and strokes, or some people might say when they walk, their legs sort of cramp up, and they sound very different, but really all of that is cardiovascular disease. Basically, the pipes are being damaged. So what happens is that the pipes get damaged a little bit, kind of like rust on the inside, and you get cholesterol buildup. So as the cholesterol builds up, basically the pipes get smaller, and therefore the blood going to your legs, you might have crampiness because you're not getting enough blood to your muscles. But if, let's say, that plaque ruptures and then you form a blood clot and it clogs everything up, if that happens in your heart, then it's a heart attack. If it happens towards your head, then that would be a stroke.
When a patient comes in front of a physician, there are a number of different questions that could go through our mind for us to basically assess their chance or their risk for having, for example, a heart attack or a stroke. Do they smoke? Are they overweight or obese? Do they have high blood pressure? Do they have type 2 diabetes? Do they not really exercise or not really take care of themselves? The highest risk for cardiovascular disease, of course, is if you already have had cardiovascular disease previously. The other things, of course, that put people at risk for heart disease is if a family member has had early heart disease. We have patients that come and tell us, you know, my father or my brother had a heart attack at age 42.
So a lot of times we say there's good cholesterol and bad cholesterol. So think of the bad cholesterol as things that are delivering cholesterol into your arteries. So therefore, the more of those that you have, the more the artery will be full of this cholesterol. The good cholesterol is the one that's removing the cholesterol. So therefore, that's moving away from the artery. So if you have more good cholesterol, then you're at less risk of heart disease. A lot of times you'll hear doctors saying, you know, lower is better for the bad cholesterol. And that's because we looked at patients that had very low cholesterol, the bad one, and we noticed that they had less heart disease. And so what we did was we designed chemicals, medications, to actually help you to lower your cholesterol. And what we found with these studies is that the people that had their cholesterol lowered, the bad one, seemed to have less heart attacks and strokes. And what we kept doing was we kept lowering it and then lowering it. And every time we lowered it, we would see that people can use it safely and there was benefit.
High cholesterol can absolutely run in families. So for example, there's a condition for super high cholesterol. We call it FH, or familial hypercholesterolemia. And of course, this is super high cholesterol that runs in families, and of course, it's genetically determined. Cholesterol for patients with this super high sort of cholesterol, FH, we're first of all having more and more options. We used to deal with things like just simple medications known as the statins, which are a very well-known class of medications. We're very encouraged because some of the most powerful cholesterol medications in the world are soon to come to Canada.
When we talk about cholesterol, there's two types of cholesterol. There's the things that we eat, and then we produce cholesterol on our own, and it's the balance of the two that actually give us the total amount of cholesterol in our body. So therefore, of course, dietary changes is very important, that's fundamental. But for many patients, that's not enough. In other words, we may have to give some medication that blocks off your body's way of producing cholesterol, and therefore lowering that. So some people might hear the word statin therapy. That's what they're doing.
There are a number of patients who, for example, we need to get their cholesterol down, but our standard, usual therapies, either they can't take them or they cannot tolerate them. So there's a significant number of patients who should have, for example, their cholesterol reduced by medications called the statins, but they just cannot tolerate them. And this is an important area that I think is gaining more attention in medicine, and that's why we're excited that there are new options available.